evening, distinguished delegates. My name is Gunasekaran Rengaswamy, and I am from UNODC, based in Pretoria. I'm very happy to be here today. Let me acknowledge His Excellency, Honorable Former President, colleagues from Sandport, SANAC, NACOSA, colleagues from the African Union, local drug action committee representatives, and a lot of civil society representatives here, and my former colleagues. Once again, good evening, all protocols observed. I'm happy to be here in this important drug policy week and the opening plenary. This appreciates the critical role of various stakeholders who have gathered here and is going to be here for most of this week's deliberations. On behalf of UNODC, first of all, let me congratulate the organizers for bringing us all together. And this is an opportune time for us to really discuss when so much is happening around us. I take this opportunity to appreciate you for your efforts in addressing challenges of drugs at the community level through your leadership in fighting for a rights-based, gender-sensitive policies and evidence-informed programming on the ground. I would like to acknowledge and appreciate the efforts of Central Drug Authority of South Africa, National Department of Health, Department of Social Development, Department of Correctional Services, SANAC, and collaboration by many other stakeholders who are present here today. To come to some of the points that I wanted to share, according to the World Drug Report 2023, globally over 296 million people used drugs in 2021, an increase of 23% over the previous decade. The number of people who suffer from drug use disorders, meanwhile, has skyrocketed to 39.5 million, a 45% increase over 10 years. The year 2023 marks the midpoint of the work towards achieving the Sustainable Development Goals. The global drug phenomenon continues to challenge both the implementation of SDG targets and efforts to promote peace, security, and human rights. The industry of illicit drugs continues to ramp up production during these challenging times. Users of synthetic drugs have multiplied in the last 10 years, and non-medical use of tramadol continues to endanger people in Africa and the Middle East. In Africa, a number of drug users is projected to rise by around 40% in the next decade, simply because of demographic changes. Although a rise in people who use drugs is predicted worldwide, it is likely to be particularly pronounced in Africa because the population is younger and drug use is higher among young people than among older people. Young populations are most vulnerable to be using drugs and are more severely affected by substance use disorder in several regions. In Africa, 70% of the people in drug use treatment are under the age of 35. This is really something that we need to be mindful of. Therefore, there is a need for a collective continental response. The UNODC Strategic Vision for Africa 2030 can support in this continental response with an integrated, people-centered, human rights-based approach, empowering African societies as they develop sustainable solutions to drug-related challenges. Even as we work in the long-term sustainable solutions, there are people who need access to treatment now. There is evidence showing the health vulnerability of people who use drugs with drug use disorders, including those living with infectious diseases and those in prisons. Therefore, it is imperative that we prioritize these groups of people. When it comes to HIV, 41% of the new infections in East and Southern Africa occur in South Africa, while another 34% in 4 countries, Kenya, Uganda, Zambia, and Tanzania. Progress since 2010 in controlling new HIV infections among adults in East and Southern African countries is insufficient to reach the 2025 target. Sex workers, people who inject drugs, men who have sex with men, their partners contribute to 32% new HIV infections in East and Southern Africa, with high prevalence reported in most countries. With poor intervention coverage, this is something that we need to be noted, and with lack of data reported by most of these countries. The data that we have may not be the real figures, that might be even more. So East and Southern Africa region did not reach the political declaration target for new HIV infections among adults in 2021. Reaching the 2025 targets needs massive effort to scale up what works. Harm reduction works. Let us put our best efforts forward to make this a reality. We need to reach those who are most difficult to reach because they need us the most, like people who use drugs, especially in rural marginalized communities and people in prisons. We need to be able to work more with them because they also face barriers of stigma and discrimination. Women are most affected, and they often face greater barriers to treatment for drug use disorders. We need to ensure access to care for all and focus on the specific treatment needs of women. We also need to ensure that controlled medicines are available for pain relief in Africa. At the UNODC, we are committed to continuing close cooperation with member states in providing care and support to people affected by illicit drugs, no matter the circumstances. Honorable President, distinguished guests, 2 core principles of the 2030 Agenda for Sustainable Development are to ensure that we leave no one behind and to reach the farthest who are left, who are put very much behind. So people who use drugs are some of the first to be left behind in almost all circumstances. Everyone has a role to play. We all have a role to play, from governments, civil society, to individuals, traditional leadership, in bringing the necessary attention and resources to this issue. And UNODC stands ready to work with everyone. UNODC reiterates the call to ensure the provision of evidence-based prevention and treatment services and recognizes the value of civil society in this regard. I'm confident that the Africa Policy Week organized here will help us to harmonize our actions and remind ourselves again to achieve a more humane, evidence-informed drug policy for South Africa. In this regard, I call on the various representatives to improve data collection in order to facilitate the design and provision of appropriate HIV, drug use prevention, substance use disorder, and rehabilitation services. Comprehensive data on drug use patterns and trends is key to developing effective treatment and rehabilitation programs. Scaling up of programs for people who use drugs and people in prisons are critical. I would like to conclude by affirming that UNODC's support to join the government of South Africa and the civil society. Let us show those who need us that we care by providing evidence-based services to promote people's health in South Africa. Let me wish everyone a successful meeting and deliberations this week for a better health for all of us. Thank you very, very much.